This conference will now be recorded.
I know. Greetings, everybody. Can everyone hear me? Hello?
Yes.
Yes.
Excellent.
Yes.
Well, thank you for joining
Yes,
on
we
the,
can hear you.
Okay, excellent. Well, very big hi to everybody. I've been excited to do this lecture or this webinar because I've been a bit frustrated about what's been going on with the cases. Unfortunately, we lost somebody, and actually was something here. They're telling me I don't have my camera on, so let me see.
Right.
So I was looking really forward to doing this lecture. Part of it was prompted because we unfortunately lost somebody in our practice to COVID, and she was young, and I just have kind of had it. I think that we need to understand really the science behind everything and really understand what do we need to do to get our community back and to not lose any more people. Hospitalization's been going up. My staff has been working around the clock, taking care of people who are COVID positive. We talk to them every day to take care of them. We check on them to make sure that their temperature's doing okay, their oxygen saturation's doing okay. If we have to make any changes, if something has to happen, they have to go to the hospital. And it has been quite overwhelming. And there is something that we can do to stop all this. And now with the vaccines out, whether you decide to take it or not, I just wanted to make sure that we all understand what these vaccines are, and whatever things are being said in regards to that, that you can ask, and then I will do my best to answer them to kind of understand whether it's the truth or not the truth about these vaccines that are out there. So let me pull up my screen and then we'll get started on our lecture here. I'm going to share my screen. I'm going to present. Okay, I just want to make sure that everybody can see my screen. Okay, all right. So this topic, let me go back here. I'm not sure why this keeps going away, but so this topic is about COVID and trying to figure out a way to make this enough already. Kind of settle the myths and misconceptions, let us get our life back in order to the way that we want to interact with people and be open and less likely to need a mask and everything else that's going on. My hopes are is that whatever's also happened over the year, that we've also learned ourselves to become more efficient, much more mindful of other people, and also much more mindful of the things that we have been doing in our life. And that by the time all this stuff opens, which I'm hoping literally will be in months, and probably really short, is that we will be even better than what we were before. So if you're looking for this presentation and any other presentations that we've done, it's going to be on youtube.com under JVC MDVIP. We'll be muting the microphone so that there's not a lot of distractions in the background, but then we'll open things up for the microphones for question and answer at the end. And this information's as of data that I've seen up to today. And again, this was prompted because of this recent loss of a member that I believe she would have wanted us to do something to be able to convey information for people to understand better about the severity of this disease and that it can affect people of younger age. And then please contact our office if you need any further information. So the agenda today is to take a look at where our numbers stand, looking at acute versus long haulers, but probably looking more in terms of the long haulers versus the acute, because I think all of us really understand over the several lectures that we've met on in learning about what the acute symptoms are, and then understanding the COVID vaccines that are available or maybe soon available, and then trying to get an idea, why is it so important about the vaccines and what you really need to know. And so a lot of this will be questions that have been out there that people have either contacted our office or we've seen throughout the media, and trying to settle some of these claims that are out there. And then significant CDC guidelines that have changed, and how to obtain the vaccine, because just recently it seems that everything is becoming a little bit more easier about obtaining the vaccine. And then questions at the end. So when we look at the cases and the trends, I'm not going to go too much into this, but you can see our numbers are way up. You see that back in April 2020, we had only 421,000 cases in the United States, and then we're now at over 31 million as of April in the United States. And our deaths went from 15,000 to 570,000 deaths. In Florida, and just doing this as a comparison between Florida and Michigan, because there's a lot of travel that's happening between the two states, you can see that initially Florida had 15,000 cases with 296 deaths in April of 2020, and then in Michigan we had 21,000 cases and 880 deaths, so we actually had more. But by the end, you could see there they had 2.1 million people that were infected and 34,000 deaths, and we had 783,000 that were infected and 17,000 deaths. One could argue the point that if we were to double our numbers to Michigan and get it equal to Florida, then we probably would have the same amount of deaths that Florida has, and Florida has a much more open stance that's going on. And I would tell you that there is some agreement that I would have in terms of opening our community, but it would be under a provision. And the provision is really related to the vaccinations. And you'll have a better understanding after we go through our discussion. And you can see in our counties, Oakland County, Macomb County, Wayne County, I mean, we have the number of cases, but you can see there's been not as much an acceleration over the past maybe 4 months, 5 months. So that's a good sign. Some of the increase that happened from October to January is really related to the holidays, Thanksgiving, Christmas, New Year's. But then when you see let me go back here. When you see that the change from January to April, there is an increase, but it's not as great of an increase as the previous months, or really last year. So when you look at hospital, Beaumont, currently they have 674 cases, and I bring this up because you all know that I'm on staff at Beaumont, and I've been on staff there for, it's hard to believe it's been 24 years. But I outlined there that Troy has 155 cases. Our hospital is only about a 500-bed hospital, and at Troy we have about 30% of the cases of COVID at Beaumont. I mean, our hospital closed down for visitors. You know, I'm seeing now the doors or floors are closed off to COVID. So it's been a bit crazy. I have been noticing too that there are a lot more younger people that have been hospitalized than older people. And I don't know if this is related, and I'm hoping it is that maybe things were right in the first place when we decided to make sure that all the people who are over the age of 65 were being vaccinated, because maybe that's now the catch up that's happening. It's still really early because, I mean, we didn't start vaccinations until the end of December or mid to late December. So our numbers are still early, but when you look at this, it'll be interesting to really see what the numbers are going to show in the next few months in terms of the numbers of people who have died or contracted COVID based on the age groups. If you're looking at a lot of the data that's out there at the different places that are tracking, you'll see that it's really the younger age groups that are now contracting COVID. which means is that there's a lot of spread that's going on there. And then there's also increase in percentage of those people younger than the age of 65 that are actually dying from the disease. But again, there is a way that we can stop this. And you can see the numbers for the other hospitals, Henry Ford Ascension, University of Michigan. Now, I bring this up. This is a difference between flu and COVID. Beaumont has this out because there's some people who say that, okay, flu and COVID are about the same. And the answer is no. Flu is not causing you to have blood clots, and there are not as many people dying from the flu as compared to COVID. I think now looking at the way things are, is that the vaccines that are coming out now and so effective that it's really going to bring COVID down in terms of the severity of disease, that it will become somewhat similar to the flu, that it will be much, much milder for people to have the COVID. But again, you'll see that in the data that I'm going to show you. And just remember, when flu came out and there was no vaccines to take care of it and nothing to do for it, there were lots of people who were dying frequently from that. And there's an expert who is on the panel for the FDA and also a panel for infectious disease and for the CDC and for the conference groups for vaccines and also for infections. And he said that there has not been one pandemic or endemic that has not been controlled without the use of vaccinations. So for those individuals who think that the only way that we can get rid of this is complete herd immunity without the need for free vaccines, that hasn't happened. Every other infection that's come along, vaccines had to be developed to stop or decrease or get the infection under control. So let's talk about the people. We all know about the acute symptoms. People losing their smell, losing their taste, they're coughing, they have terrible headaches, they have high fevers, they're short of breath, they're coughing. They might have diarrhea and bowel symptoms if they have the intestinal form of it. But what we're starting to realize is that there are people who are what we consider long haulers. They have symptoms that are lasting several weeks to months, even after they have finished or considered to be recovered from the virus. It's also being referred to as post-COVID-19 syndrome. There are other names that are associated with it. But they're noticing that 50 to 80% of people who have been infected with COVID still have bothersome symptoms greater than 3 months from the onset of their symptoms. And this is a problem. I mean, because these are people who want to go back to work, they want to go back to school, they want to go back to their families, they want to have some sense of themselves, and they can't get to that because they're ending up having persistent symptoms. Now, I look at it, there's two types. There are the type that there's really not much in objective findings, it's really more subjective. I have a headache, I'm really fatigued, I feel fogged in the way I'm thinking, but when you look at things biochemically in their labs and you're looking in radiographically, there's not much that's there that supports that. Not to say that they're not having those symptoms, they are definitely having those symptoms. And then there's the other who have the major objective findings, and these are the ones who are really severe. Those are the ones who have had a heart attack or a stroke, or they have blood clots, or they end up having such bad pneumonia that it's destroyed their lungs and other organs, like having renal failure. And so those things, there are objective findings for that. But regardless of either one of them, it's causing people to have debilitating symptoms that are following them for months afterwards. So some of the things on the milder side that they'll end up having, but forgive me for saying milder side, but they are still significant to the individuals: fatigue, body ache, shortness of breath, difficulty concentrating, inability to exercise, headache, difficulty sleeping, lack of taste and smell. And then again, the real severe ones will have the cardiomyopathy, where it's damage to their heart, a stroke, which is the CVA, a pulmonary embolism, which is the PE, DVT is the blood clot in the legs, myopathy is the weakness or problems with their muscles so that they cannot really get up and walk and do a lot of activity, scars to their lungs. And there's a lot more that's related to that, but I'm just picking out the ones that all of us would probably recognize the most. Now, there has been some data that show, or some, I should say not really data, but there were reports of people saying that after they received the vaccination that had an improvement in their symptoms. Now, we're trying to sift this out, but part of it, the thought is maybe the virus was still hiding in the body and maybe the vaccination helped. Not really sure that really is the case. Maybe it's because the person just felt lifted, or it ramped up your immune system that now caused you to feel better or more energetic. We don't know, but this will be interesting to find out in further studies or reports from people that if they receive the vaccination that they start to feel better. Now, the reason why I bring up about the long haulers is because it is one of the things that all of us should be trying to start to think in our mind is that, well, I don't think that we should try to get infected by this and see if that we can fight through it and that we're going to do okay. Because if you're one of these unfortunate long haulers, then you can end up having symptoms for long that's going to cause you to be disabled. And you might not be able to work anymore or interact with your family or do anything, and it might be on a chronic basis. Or you could die from it, or you can end up having other bad organ failure issues, and now you're dependent on dialysis or in and out of the hospital because of congestive heart failure because you had the cardiomyopathy. So those are things not to play around with and say that, okay, COVID's not really serious and that I can take the chance and get the infection, because those are things that are not acceptable in terms of your health to fight. Also, when you look at this is a table that's showing the hospitalizations and deaths compared to the 15, 17-year-olds. I think all of us know this significant increase in risk that's related to getting older. But I'm bringing this up because everyone's just looking at over the age of 65. But look at the people 50 to 64. They have a 440 times chance of death compared to the 5 and 17-year-olds. So 5 and 17-year-olds, and also the people who are in the 40 to 49 group who are 130 times the risk. And look at hospitalizations. No one wants hospitalized. I mean, even though you guys know from me that I enjoy taking care of people in the hospital because I love the severity of it, you know that my focus is trying to keep you out of the hospital. And so these are things that, once you know these things, you're not only not wanting to be a long hauler, but you also don't want to be hospitalized. And then you also don't want to have death. And these are numbers that are completely against us for us who are really over the 30 age group. So how does this all work? Our immune system, it takes days to recognize and develop cells to fight an infection. So what we're learning now, and some of you have already heard me say, is that a lot of this all depends on the amount of viral load that you're exposed to. Meaning that if you were exposed to a lot of the virus at the initial outset of the infection, then your chance of being hospitalized and dying is much higher than that individual who had lower. So for those individuals who want to say masks don't work, masks do cut down the amount of virus that's circulating, so that if someone's coughing, yes, they're coughing their mask and they might be auto-infecting themselves, but at least whatever they have is not being in a direct line into your face and you're getting a high amount of virus into your system. Now, why is this really important? Because our immune system takes some time to develop the cells to fight infection. So think about it this way. If you get this virus in your system, the virus can roam around your body and not be recognized by your body because it hasn't developed antibodies or T killer cells or T helper cells or any other cells to recognize it, to fight it. So that virus now starts replicating. It's multiplying until the point that your body recognizes it, and then your body now starts to make the cells to go and fight it. Well, that process can take anywhere from 4 to 7 days to happen. So during that 4 to 7 days that's going on, that virus is now just doubling, triple, quadrupling, and just going into very high amounts. So by the time your body has enough of the cells to go and fight it, it just is overwhelmed. It cannot go and fight it. And that's when you start to decline. Now, when we look at vaccines, we look at different types of vaccines. You can have a live weakened vaccine that's given to you, or a dead type vaccine given to you, or something that helps to block the toxins that cause an issue as an infection, or an antigen type where you actually identify a very small portion of the virus that's characteristic of that virus, and then find something where you can start to develop antibodies or the fighter cells that you need to fight it. Now, the vaccines, once a person's given the vaccine, then their body is now exposed to a portion of that virus and now starts to make the cells. So now those cells now sit and reside in your body, and they're sentinels, and they wait and circulate around until they see that, oh, here's this virus, I recognize it, I'm going to attach it to it, and then I'm going to send a signal to all the other cells to come and attack this cell and every cell that looks like it. So when a person gets a vaccine, generally what ends up happening is that the virus doesn't have a chance to multiply in high amounts to cause an overwhelming infection. Now, yes, it's not 100%, and we'll talk about that in a moment, but it does a very good job. And vaccines are considered to be efficacious if it's greater than 50% in its ability to penetrate into the community. And you see numbers. Those numbers, you'll see 95%, you'll see 90%, you'll see in the 70%, and you'll see in the 60%. And we'll talk about that shortly. So when you look at the mRNA type, and this mRNA vaccine, it creates the blueprint for the surface spike protein. And I guess I need everybody to understand this part of it. And this is what's so novel about it. Yes, mRNA has been out since 2005. They've been trying to figure it out. The problem with mRNA developing that is brittle. So as soon as it gets introduced in the body, it gets destroyed. So they had to find some kind of system that allows that mRNA that has the code of whatever protein they want to make to get into the body. And what they did is they now surrounded it with this nanoparticle, which now this is where people say this nanotechnology, which now this is a lipid layer or fat layer where now that virus is, that mRNA is inside that fat cell, and that now can allow that to get into the body, and then that fat or lipid material then just disintegrates. That mRNA now carries the information or the blueprint that says this is the UPC code essentially, or the address or the composition of this spike protein that's on the surface of the virus. So it's not a live virus because it's just only the surface of the virus. And I'm asking you to make this in the body so that once you make this in the body, then the body will recognize it's not right, and now will attack it and make the antibodies and the other memory cells that need to be done in order to fight if your body comes in contact with that virus. Contrast that to now getting what I explained at the start, which is if you got the virus, then your body would have to take several days to make the cells in order to fight. So now here you have a vaccine that's given to you that is just the blueprint to make a copy of it inside your body, to make this wanted poster and say, hey, if you ever see any of these viruses that are around, go attack it. And they're already on the ready. So there's not a chance for the virus to really replicate high enough in order to cause a significant infection in an individual. This is very important because this is the understanding of what the new finding and the release by the CDC about people now, instead of getting less likely to get sick from getting the vaccine or getting the illness, but also less likely to transmit that virus or infection to somebody else. Because when you look at this, they don't develop enough viral particles in their body to really give a significant infection to someone. I'm not saying it's zero, but it's definitely close to that. So when you look at the efficacy reported on the vaccinations, that percentage is a report of what you're less likely to be sick from the disease. So when they say that there's a 95% immunity or efficacy that you have with the Moderna and Pfizer, that means you have a 95% chance, less chance of getting ill from it. But still, there's that 5% chance that you could get infected with COVID. And so that's why if you are around people who have been unvaccinated, or there are people who are at risk for getting COVID, you still have to take precautions with that. But you should also feel comforted in the fact that you're less likely to pass on an infection to an individual, and it would be a much lower percentage. And that's huge, because I think all of us have a heart, and that we also have a conscience, and we're not trying to go and get other people infected, and that we're mindful of their feelings and their health. You know, it's tough when I see or hear things that someone says, well, you know, I don't need to do this and I didn't need to take, okay, fine. I mean, you may be looking at yourself and not worried about you getting infected, but there are other people around who are worried about getting infected, who are at risk of getting that. And I think that's really quite disrespectful for people to put other people at risk for infection. It's one thing to do something in your own body and then maybe you don't care, but to put other people at risk, that it's just not fair. So the difference in the efficacy you'll see in the vaccines, where you see some that are 95%, and you'll see some that are 76% or 72%, and others 66%. You have to be very careful about how those are interpreted. And I'm going to tell you that some of the thoughts are in, you know, because initially J&J was thought, okay, that's not a great vaccine because it's only as good as 66% or 62%. Well, you know, the difference between the J&J and the way it was tested versus those were tested for Moderna and Pfizer. Moderna and Pfizer were tested at times when there were lower count or lower acceleration rates or lower rates of COVID that were going on. And they were also done in areas where there probably was not much of the variance. But when you look at the J&J studies were done in an area where the variants were very high percentage that were around. And that it was also at a time when there was a significant increase in the amount of COVID cases that were going around. So you wonder if Moderna and Pfizer, if they tested the vaccines during the same period of time that J&J was doing it, that would they have had lower efficacy rates? So the bottom line with all these vaccines is that it cuts down the chance of death, and it cuts down the chance that you'll be hospitalized 100%. And you'll see that in a moment. So our end goal with the vaccines, yes, we would love to try to prevent ourselves from getting infected, but more importantly is that we don't want to die and we don't want to be hospitalized, which what's been found universal to all the vaccines is that 100% you will not die and you won't be hospitalized. Now, will eventually something will happen along? Yeah, probably. You're talking about millions and millions of people that there's going to be somewhere or another there's going to break through, something's going to end up happening. But for the majority of what we're looking for to do so that we can get our life back on track is that we want to get this thing out of here. We want to make sure that we're not getting infected, and we want to make sure we're not passing any infection to anybody else. And for those individuals who decide not to have the vaccination, they should feel very comforted in the fact they'll be surrounded with a whole bunch of people who, if they decide to have the vaccine, that are less likely to infect them. And that's why you're seeing the changes in the CDC guidelines, and you see they're so new about the changes. This is a table from Beaumont that shows the differences in the types of vaccinations. You can see now that we can vaccinate 16 and above. There are actually studies that are going on, and it's pretty favorable in kids under age of 16. So I suspect that sometime soon there's going to be a recommendation that they're going to be allowed to be vaccinated. But you can see Pfizer can be done as young as age 16, and all the other ones have to be 18 years and older. Now, AstraZeneca hasn't been approved here in the United States, and we'll talk about why it hasn't yet, but you'll see why there's been a pause on that. But when you look at the disease prevention clinical trials, you see the differences that are going on. Now, it's interesting that Johnson & Johnson, theirs is at 66%, but that was out to, I believe, 49 days. And as the data is still collecting and that they're seeing people at 60 days or 80 days or 90 days or 100 days, that percentage is improving. So once they get their data out, and they'll determine about how many days to their single vaccination will be much more effective about preventing the infection. Again, when you look at these percentages, if you look at Pfizer and Moderna, they're 95% effective about preventing from getting infected, but there's still a 5% chance you can. And when you look at Johnson & Johnson, 66% chance that you're not going to get infected, but there is a 34% chance that you could still get infected. And same thing with AstraZeneca, you have a 30% chance that you can get infected. So again, that's why that you still have to wear masks and social distance and sanitize and just do all the mitigation measures, because there's still that small percentage you could get infected. The reality is that the amount of virus that you would develop once you're fully immune, and fully immune means you're 2 weeks out from whatever that last dose you're supposed to get. So it'd be 2 weeks after your Johnson & Johnson or 2 weeks after your Pfizer and Moderna, and then you would be considered 80% less likely to infect somebody else. So these are huge. This is huge information. I mean, again, remember I said, in order for a vaccine to be really effective in the community, they're only looking for about 50%. And you're looking at these numbers that are significantly high. And not only they're seeing a decrease in infection rate in the individual, but also the decreased ability of that individual to infect somebody else. And that was the last piece that we were really looking for in terms of the efficacy of the vaccination. And then we'll talk about the safety soon. But you see the difference in the way that there's storage. And it's a problem in places that don't have very high freezers that can really freeze up the vaccine. This is another one that my partner, I think all of you know that I have a new partner, Dr. Ehrman. He's amazing, and he sent me over this. This will give you an idea of the differences of the vaccines. We've talked about this before, in previous lectures in regards to the differences, but just in case someone's interested in looking at that. So AstraZeneca, so why has it not been approved in the US? So we talked about this before. It's an adenovirus that can infect chimpanzees and doesn't infect humans. And so what they did is they embedded a DNA into the adenovirus, and that DNA then gets delivered into our body to instruct our mRNA in our body to make the spike protein. That's how it works. So the problem is that they found that there's some rare blood clot issues that happen. I mean, there's already a really rare condition that can happen where you can have blood clots to a portion of your brain. And in the UK studies, they had high-risk people that were in there, like women who were on birth control, and other people who might be at risk for blood clots. But in the UK studies, they didn't see a single case of this rare blood clot issue. But in Germany, they found that 7 of them had there, and across Europe, they had 18 women across Europe. And so it's this condition, cerebral vein thrombosis. So then it was on hold because they're trying to figure out whether this clot is really associated with this vaccine or not. So the question is do the people in Germany or Europe ending up having a higher, or a population that has a higher risk for a blood clot than the people in the UK? We don't know that answer yet. So they're sifting through the data and trying to figure out these individuals who had these conditions, what kind of risk factors they had. So this part of it also shows that what we do in terms of analyzing anything, whether it's a medication or a vaccination, works. I mean, here it is, it's being studied before it comes out, and then it's also studied after it came out. Because AstraZeneca came out in the other countries before it came, and it hasn't been approved here yet. So they're all doing the right thing. People were getting the vaccine. They started seeing that there were some problems. They stopped it and paused it. They're still trying to figure out whether it is a cause, meaning that it is related to the vaccine or not, to determine whether it should get restarted to be given to people or not. So the other part that the U.S. has not approved it is because the numbers are kind of not defined. And you remember when we had our lecture several months ago, and we were talking about how AstraZeneca had, well, there was a mistake, and then they gave half the dose and then the full dose, and they found out that did better than having the full dose. And so they're trying to sift through those numbers, and there were some other numbers that came out that everybody said, well, let's let them figure out their numbers and what they're reporting, and that let them bring those numbers to us, and then we'll figure out whether we believe those or not. So the process of what happens with evaluating a vaccine is there. So if people are really concerned and say, okay, well, these vaccines that came out so fast and that we shouldn't believe it, well, again, you've all heard me before. Our abilities now have tremendously increased. Our ability to build a rocket, our ability to build a home, our ability to build roads, and ability to make medicines. Why would we think that we don't have this ability to do this with vaccines? And I'm going to tell you, going back to what we talked about before, well, part of that ended up happening because, remember, if I told you I was going to develop a measles vaccine, how many of you were really going to go and volunteer to be in a study group to go and do the measles? But now you have the COVID vaccine, and you have people volunteering left and right to be in this, that now there are all these standardized trials that have ended up happening in multiple countries and tens of thousands of people, that it did go through the process all the way to the stage 3 and past, that is needed to determine whether something is safe and effective and that it should be approved. So it just happened really quick because they were able to get the people quick. We had the technology that was quick, and we had the cooperation worldwide about how to do this. That part of it is one of the reasons why the vaccines came out so fast. And then I want to go back a little bit on the mRNA. So mRNA, we talked about that it was out since 2005. But the development of trying to get the mRNA and something to get into our body so it doesn't get destroyed immediately, that technology didn't happen until about 3-4 years ago. So that's the part that now accelerated mRNA vaccines to work better, or I guess to go from theory to now application and work. So this is a picture of how the mRNA works. You get the spike protein. All we're doing is trying to get this spike protein that's unique to the virus, get it into the mRNA. The mRNA maps this out. It gets into our body. Our body then produces and makes these spike proteins, and then stimulates the formation of the antibodies and the T cells or memory cells that are needed to now reside in our body until the virus now comes into our body and then it attacks it. And the thing about this, it's really pure mRNA. And I think you need to know that because it's going to be important for some of the questions that we're going to be answering. So where's Beaumont in the health vaccine progress? They've already had over 142,000 first doses of vaccine to people, and over 97,000 people that they've fully vaccinated. They are doing 10,000 a week with a capacity to accommodate 50,000 a week, but unfortunately they're getting limited supply, and so the original deliveries or allotments are not coming in as what's expected. So they're having a hard time getting supply. So if you notice that people were trying to get their vaccines through Beaumont, and then there was a lull and said that, okay, we can't do any vaccinations because they were not getting enough vaccines to do it. But things are ramping up now. I would tell you that even in the hospital, I saw somebody today, and he ended up undergoing a heart cath that ended up going very well. And before he left, he was being given the Johnson & Johnson vaccine. here at Vermont Troy. So it's just kind of amazing that we are having this capability now that it's extending not just to the vaccine clinics, but trying to get people vaccinated and giving them the offer to get vaccinated at the hospital before they leave being discharged. There's 3 vaccination sites, Troy, Southfield, and Dearborn. So COVID vaccine questions. A lot of this is all based on what everybody's been concerned about. So one of them, can I get the vaccine after being COVID positive or if I do not know I have infection? And the answer is yes, you can. Although recommendations are saying that probably wait 90 days after your symptoms started, but you can't wait if you didn't know that you had the infection and it happened. But we're not noticing that people are getting more sick getting the vaccine when they had the COVID infection. And so this had been an issue before because people were saying, okay, well, if I've had COVID before and I get the vaccine, I'm going to become sicker on the vaccine because I've had COVID before. Well, we're not seeing that in the people who are being followed who had COVID infection and getting the vaccine afterwards. So that is not true. When can I have surgery after vaccination? Well, I think a lot of this just comes down to common sense. I mean, if you're concerned still about the counts that are going on, then you probably should refrain from doing it. But generally, you probably wait. I mean, all of us should be waiting until 2 weeks after vaccination to do anything, because that's when you're supposed to get the peak of the protection on that. Can I mix the vaccines? Some people have been asking, can I take the Moderna one and then the next one I'll take the Pfizer? And the answer is no. The recommendations are you stick to the one that you were given. What if my second dose is delayed? Well, we had an issue about that. It could still be active to 6 weeks after the initial dose. But then there are some thoughts that they might be still okay up to 60 days after their first dose. I wouldn't push that. Just try to follow along with the recommendations and try to be on time with your vaccinations as best as possible. I know there are circumstances that happened that delayed it. The person had some illness, maybe not even related to COVID, that delayed them from getting their next dose. Will they get a confirmatory card of the vaccination? The answer is yes. You're supposed to get a card that identifies the vaccine that you received and when you received it. And so please keep that. What if I'm pregnant or want to get pregnant? So there's been a lot of controversy about stuff like this because there have been reports about people getting sterile on getting the vaccine. I mean, when you look at this, and I want to go back to the mRNA vaccine, if the mRNA vaccine only encodes to make the surface spike protein and to make a mirror image of it, and that's all it does, nothing else. And if that spike protein has the same issue because there's protein that is supposed to help the placenta, I guess, be more intact and be more helpful for the baby, that if you make an antibody to that and that spike protein has something very similar to another protein that's supposed to shore up the placenta, then you could potentially develop an antibody against that protein. They both belong to something called fusion proteins, but they belong in the same category, but they're totally 2 different molecules. So that antibody has to be able to identify that specific molecule and attach to it. And this molecule of this protein that's supposed to help shore up the placenta is a different molecule and it looks different. And so that antibody can't bind to that. And, clinically, we're not seeing this. And also on the studies, that's not being seen, because if they are identical, meaning that the spike protein has it, and then we have this in our body, and that the antibody was developed, then that would mean that anyone who had a infection with COVID naturally, then we should be seeing a whole bunch of sterile rates happening with women, and that's not what we're seeing. So That is not true at all. The vaccine will not make a woman sterile. So in terms of pregnancy and wanting to get pregnant, there's not enough data, but the general recommendation is to go ahead and have the vaccine. The thought is that mRNA type vaccine may have a lower risk than the intact replicating virus, because you're not introducing a live virus into your system with this intact replicating virus. You have something that's just the surface protein. And again, will it sterilize a woman? The answer is no. There's this similar protein binding, but it's different, and we should have seen a whole bunch of cases that have been going around worldwide that people were getting infected with COVID if it was the same similar protein and that they were becoming sterile, and we don't see that at all. What if I had a severe allergic reaction? So I think all of you have heard me before that said that if you have a severe allergic reaction, then you probably should not have the vaccination done in a pharmacy, and probably better in a hospital setting. Now, the hospital has made a set of recommendations, and they're saying that if you've had a severe allergic reaction to a vaccine or injectable medication in the past, your immunization can only be given after approval by an allergist or immunologist. So if you had a really bad reaction, then we'll have to send you to an allergist or immunologist to get their blessing to say that you can have the immunization. If the allergy was just a food or environment, I think you've seen me on my videos where I went to go get my vaccination. After you get your vaccination, you're into a period where they observe you for 15 minutes. But if a person has food or environmental allergies that are pretty significant, then they'll end up observing that person for 30 minutes just to make sure. Remember what I said is that when I was there, and the over 100 people that were there at the time, I didn't see one single person having to be attended to for any allergic reaction or reaction. And CDC is reporting that most allergic reactions will occur within 15 minutes. So they're just being watched out to 30 minutes. Now, there was also some additional information that they were thinking that the allergic reactions that people will end up having is not from the mRNA portion of it. It's really from the lipid layer, or that the fat layer that's helping to protect that the mRNA to get into the body. So if a person, it's suggestive that if a person does have severe allergic reactions, then one might say that it might be better for them to end up having something like the Johnson & Johnson, or if the AstraZeneca gets approved, that they would be better off getting that as opposed to the mRNA. Is one vaccine likely to cause allergic reaction? So again, what I was saying is no, but if it's related to the lipid layer, then the mRNA could result in more allergy. Natural versus being vaccinated. So if you had the infection, are you better off that the infection will protect you better than the vaccination? Well, we're finding out more information on that, and it seems that the being vaccinated is better than being naturally infected. And the thought is that in the vaccination, it's ramping your immune system so significantly that the amount of antibodies and memory cells that are produced are in better quantity, or maybe much more aggressive than if you had the natural infection. So it would be to your advantage to get vaccinated, even if you have had the infection. Do the vaccines contain aborted fetal tissue? Okay, this is this huge thing that's been said, that people say, okay, you can't have that because they're making it out of aborted fetal tissue. So back in the, I think in 1960s, 70s, 80s, in Norwegian areas, that there was legal elective fetal abortions that were done, and so that tissue was saved. And so when they saved that material, then what they did is they replicated it over time. So generations and generations and generations, and multiple cell lines that they took from this original material that was obtained somewhere in the 60s, 70s, or 80s. And so that would help. Those cells were then used to try to help test or develop medications or vaccinations over time. But that had stopped, and so they were only using the replication of those cells from back years and years ago. So it's not truly the direct fetal aborted fetuses. It is now taking whatever that was done before and replicating it over time and replicating the next one, replicating the next one. So the Vatican ended up commenting on this, and they have, their position is that the disease is much more dangerous, and even though it may not be morally the way they would have wanted it, that the risk of having the infection versus and not taking it, that would not be reasonable. So their position is that it is okay to take the vaccine, especially if there is not an alternative. So you'll see here, this is in December 2020, that they said it was morally acceptable to receive the vaccines developed from fetal cell lines of aborted fetuses as long as there was no alternative. And then they defined that the benefit of the vaccines outweigh the immoral acquisition of the original tissue. So when you look at this, the two, so Johnson & Johnson and AstraZeneca were developed off these cell lines, and they're called immortal cell lines. They're not of the fetuses itself, but it was the progeny or the duplication or replication that happened over years in multiples, so that helped to develop that. So you can see it was nice that the Vatican came in and said that it would be okay. So I guess the other way I would want people to think about this is that as much as an awful thing that ended up happening with aborted fetuses back then, wouldn't it be a tragic loss to not be able to use something like that to help develop things in the future that would benefit mankind? And, you know, no one wants something that's awful, but, you know, our hopes is that anytime something awful happens, we learn from it and we become better, and that we develop something great from it. And I would think that this would be something that would fit into this, that something great developed. And many things have developed great over the years with the treatment of certain diseases and with vaccines, with the use of material like this. Now it's not much of an issue because there's a lot of people who are just donating cord blood, and so there are many facilities across the United States and really throughout the world that are carrying genetic material that's being held to be tested. And we've talked about that before. And when is the vaccine effective? It's usually maximally 7 to 14 days after last dose. I think everyone should really wait 14 days. So what are the significant CDC changes for vaccinated people? So if you decided to get the vaccine, there are changes that happen with the CDC, and it's as follows. You can visit with other fully vaccinated people indoors without wearing masks or physical distancing. And this is new, right? And a lot of this has now come because of what I said. Now this is very high in its efficacy in not getting you infected, and it's now being seen that it's very effective of you not infecting other people if you've been vaccinated. And the other thing that you know is that we're seeing that people who are vaccinated have better immunity than the people who have natural immunity, have had natural infection, I should say. That you can visit with unvaccinated people from a single household who are at low risk for severe COVID-19 disease indoors without wearing a mask or physical distancing. So this is really big because this is now helping everybody feel a little bit more comfortable that they can go visit people and not have a mask and just be much more normal about what's going on. again, being mindful of the risks that the other person has that may not have been vaccinated. And then we can refrain from quarantine and testing following a known exposure if you're asymptomatic. So, it's hard not to run into somebody who's positive for COVID. And all of you, we've had a scare here where we had somebody that ended up here and ended up having COVID. And so fortunately, all of us have been vaccinated, but we cut back on seeing people here. And then we ended up getting tested just as a precaution, and we all tested negative. But maybe that's all to the testimony that that's why the vaccine works, then we don't have to worry about it. But now the CDC says that if you've been exposed and you've been vaccinated, you don't need to quarantine unless you have symptoms. And if you have symptoms, please put yourself in quarantine, and please also get yourself tested so that we could see if you are affected and you can pass on the infection to others. And again, fully vaccinated means 2 weeks after having the 2 Pfizer or 2 Moderna or the 1 Johnson & Johnson. Now, everyone's asking about travel, and CDC just changed this as of April 2nd. They're saying that fully vaccinated people can resume domestic travel and do not need to get tested before or after travel or self-quarantine after travel. Now, this is huge because, I mean, I've been getting things about, okay, I'm traveling, I need to get tested beforehand, and so, I need a letter, I need this. And this has just changed just days ago. But, I'm sure that this is all going to be dependent on the cooperation of the travel industry and what their requirements are. But that's why you have to keep your card so that your card shows the proof that you've been vaccinated, and that way, if the travel industry does follow along with this and says that you don't need to go get tested or self-quarantine for all this stuff, then this will be really great for everyone to travel. The other thing is that fully vaccinated people do not need to get tested before leaving the United States unless required by the destination, or self-quarantine after arriving back in the United States. So this first one was on domestic travel, and then this second one is in relation to international travel. But again, it's all going to be dependent on that country's requirements and whether the airline industry or the trains or whatever means of travel that you're going to have is their policies. And then again, fully vaccinated, meaning you're more than 2 weeks from your vaccination. So, but what do vaccinated people, what's still required of people who are vaccinated? Still mask and physical distancing in public. They don't know that you've been vaccinated. There are people out there that are still afraid to get infected, which they should be. I mean, and we need to be respectful and mindful for those people who are concerned about that, whether they want to get vaccinated or not. Again, this is not a judgment thing. We just need to do the right thing and be mindful of the other person. They might not want to get the vaccine for whatever reasons they have. Hopefully, whatever discussions I had during this time will reassure them about some of the misinformation that's out there in regards to the vaccine. But there's the usual precaution with being around unvaccinated increased risk individuals, usual precaution being with unvaccinated individuals from multiple households, avoiding medium to large size in-person gatherings, and get tested if you're experiencing COVID-19 symptoms, and then follow the guidance issued by individual employers, because not everybody has to follow, every place of employment has some set of guidelines they follow, and then just follow the CDC and Health Department travel requirements and recommendations. So where can I get the vaccine? Everyone's been asking this, and so we've been trying to compile where people are getting it, from people who've already had the vaccine to things that are coming out to, I guess, just some websites that you can go to that you can find it. So you've heard me all say before, register with all the pharmacy chains. They cannot call you and let you know that they have the vaccine if they don't have a name, telephone number, or a way to contact you. So please register with all of them. Register with the hospitals, same thing. They can't call you to say that they have the vaccine and offer it to you if they don't have a contact number. Register with the county health department. There are some places, Jen was saying and helped to guide, and she's been so amazing helping people get the vaccine. Some of the county health departments, I think it's Macomb County, that has where you call on Tuesdays and Fridays, and then for the first 5,000 people who call in are going to be, I guess, have the spot for the vaccine. But unfortunately, you have to wait on hold, and then once they answer, you're like number 1,230, whatever that they do. So just give them a call. And this smart is, apparently they have the smart bus that will help to drive people to the place to get their vaccine. So this is really good because for those individuals who can't get out of their home and they don't have transportation, the smart bus can be sent to go pick them up and take them to their appointment. I'm not sure whether Oakland County and Wayne County have the same thing. I would hope they would, but I'm glad that Macomb County has that. And Wayne County, I put this on a little list because it will be on the next slide, but they have a lot of listings for places, which I was glad to see. Ford Field, Meyer and Henry Ford, actually, you can text NCOVID to 75049 or call this number to get an appointment to get your vaccination at Ford Field. For retired military, one of our members who's military had recommended that they call this telephone number to see if they can end up getting the vaccine. Oops, where am I here? So then if you look at vaccinefinder.org, this can list which pharmacies have stock and which vaccine. This is actually quite amazing. I just learned this yesterday. And this, if you put in your area, if you put in your zip code, then it will pull up the pharmacies that have the vaccine. If you click on these arrows, it will tell you which vaccine that they have. So whether they have Johnson & Johnson or Moderna or Pfizer, if you have any preference to get whichever vaccine. And then you would just contact them and see what you can do to schedule an appointment. So this is quite an amazing resource now. And this is that in Wayne County, you can see all the different telephone numbers you can call to try to get the vaccine. So it's out there. The means to get the vaccine, there are multiple ways to get this now, and whether through the hospital or through the cities or through the pharmacies. I mean, and I think there's some other unique ones that are around, but please try to get your vaccine. It is the way. When you look at the vaccine, it is 100% its ability to not have you die or be hospitalized. It also decreases your chance to infect other people. It's safe, it's effective. It is the way, if you look at it this way, if you had 1 billion people and all 1 billion people got vaccinated, this is how this is going to go away. There's not the chance that that person is going to get infected, and they're not going to pass the infection to other people. So the more people that get vaccinated, the better. If you decide not to get vaccinated, that's okay. Hopefully, if you decide not to get vaccinated, that you're doing it based on the real or truth of everything that's out there and not related to things that could be looked at as a conspiracy, or that's, that it's, I don't know, I can't even think about what to say without saying something that could be construed as disrespectful, because I don't want to be disrespectful. But this vaccine helps, and it's been shown in other vaccines in the past to try to eradicate disease when it was running amok and hurting a lot of people. So if everybody wants to stop the masks, if everybody wants to stop the lockdowns, if everyone wants to stop the social distancing, everything that's related to that, then we need to get vaccinated. We can't have people getting infected, because if they're getting infected, there's a strong chance they're going to be either a long hauler, or they're going to end up having an organ damaged, or they're going to have some other chronic condition that's going to be a problem, and that's not acceptable. And this death that just ended up happening, I think, is completely preventable. I put this in here because people have been asking about the visitation at the hospital, and it has changed. They're looking at visitors who have not completed the vaccination, then they have limited ability to go and visit. And people are going to say, well, okay, that's restricting. Of course it's restricting. No one wants to bring infection into the hospital, and no one wants someone to get infected in the hospital. I mean, it's a huge liability both sides. So you would want to try to limit the chance that you're going to end up spreading disease. So those people who have completed the vaccination, things are a little more liberal for them because we understand they're less likely to infect anybody and they're less likely to get infected. So they do end up having more liberal ability to come and visit at the hospital. So in summary, taking the risk of getting COVID infection is not a good risk due to the risk of chronic disease, debility, and death. I think it's going to be really interesting to see the data this year, the percentage of deaths related to COVID in individuals greater than 65 due to the focus of the vaccinations have been in the older population. And if we see that the older population in several months that the death rate is going down and the hospitalization of that age group is going down, then we know that the vaccine is working. If we see that in the younger population that there's an issue and they're being hospitalized and getting ill more and the death rate's going higher and they weren't being immunized, then that's also going to be important data that we'll see. And hopefully we just can get everybody vaccinated. And if you notice, the guidelines have said now that greater than 16 now can get vaccinated. So this is quite amazing that they've opened things up. And as I said before, I suspected that was going to happen pretty quick about opening up the community to vaccination. Register everywhere for the vaccination because the restrictions have loosened. So again, they can't contact you to offer you the vaccination if you don't have any contact information for them to contact you. And then opening up our community is dependent on preventing severe disease, hospitalizations, and death. I mean, isn't that ultimately what we're all afraid of? One, that we're infecting each other. Number two, that person's going to die from it. Or three, they're going to be hospitalized from it. So how do we stop it? We already know that the COVID vaccines prevent death and hospitalization 100%. So the bottom line is that COVID is now a preventable disease, and there's no reason any longer to lose another life. So I'm hoping that everyone learned a lot from that. So if there's any questions, let me see. I'm going to move my screen here so that you can all see me.
Yeah. Hi, Dr. CALADO? Yeah.
Yes.
Can you hear me? Okay. Larry Slumick. I've got a few questions here. So from what you were saying, okay, we've got a couple granddaughters that had COVID about 3 months ago. Should we be recommending to their parents that they should get, one of the vaccines as soon as they can, or should they wait longer, or what? What's your feeling on that?
Well, our thought is that natural immunity can last maybe 3 to 6 months. We've been kind of tracking it over here. We had some individuals who were infected with COVID watching their antibodies, and we noticed that around 6 months that their antibodies might go away. So I would say that if you've been infected, probably should think about getting the vaccine probably about up to 3 months out from the infection. I don't think there's a big rush that after you've had the COVID infection that you should go and get the vaccine. I think you could wait it out to about 3 months and then get the vaccine. But yes, I think they should, because the vaccinations are showing a much more robust protection than the natural infection.
All right. From the vaccines as we know it, I know this is early in the process, but you feel from any insight as far as when we might need a booster shots if we've had the vaccine already?
Well, I mean, the thing is that, so the data right now, it's pretty early. So most of it, they're looking at 3 to 6 months data on it. And all they can comment is that if they only have up to 3 to 6 months data, they could say, okay, you would have immunity up to this point in time. I think that with the high percentage rate of efficacy on it, the thought is that it's probably going to last a long time. But until we have 2 years out, 3 years out to see that there's still the immunity there, that they still have their memory cells and they still have a large amount of them, and they also have the antibodies, we won't know until then But the suspicion is, by the experts, is that we'll likely end up having lung immunity with it.
Yeah, one last question at the moment. All right, when we had our vaccine, they had some buttons that you can pin on that, you know, you've been vaccinated. Can we get some more? Yeah, you got that one.
Yeah, actually, so
Where do we get some more because we only got one and we both need one for.
well, actually, if you've been vaccinated, Jen has been amazing, and she had buttons printed out at her office. So if you just show us the proof that you've had it, then we'll give you a button that shows
Okay,
you.
great. All right. I'll let others raise questions for now.
Oh no, those are all great questions. Oh, I need to go back and I need to say something because I'm thinking now there's some error that I had. You know, so there's some issue about whether people should be taking something prior to having their vaccine, like Tylenol or Motrin beforehand. In some individuals, I've recommended for them to take Tylenol before their vaccine on their second one because there was some really um, a lot of things were circulating that people were saying, okay, after the second vaccination, that they were going to have something really severe, and that they didn't want to go through that, or they were afraid to do that. So, one could take some Tylenol ahead of time. There's something about fever that's very protective on us, and so part of when you get the vaccine is now teaching your immune system to develop the cells to go and develop your immunity. And so part of that could cause you to end up having a fever, and that part of it would be good for you. So if you can tolerate the fever, then don't take the Tylenol. If you can't tolerate the fever, or you're having such severe headache or bad muscle aches from it, then you have no choice, but you have to take the Tylenol or Motrin to try to take care of that. So I'm going to change my recommendation that I had before, that in individuals that if they wanted to preemptively take care of that and fight it, because there's thoughts that if doing that could decrease the efficacy of the vaccine. And so because of the variant, it might be a better idea just to fight through the fever and the side effects that are going on with it than decreasing the chance that it could be resistant to the variant. And by the way, maybe someone's going to ask this, so I'm going to say it in advance. The variants that are out there, so far, the vaccines are effective against it. There are changes that are going on, but the changes have not happened enough that the vaccine cannot not work on them. It is working. And the right thing is what we do with everything, is building a better wheel, that the vaccine will become better because it's going now take on all those different variants that are on there, and they'll make a better vaccine. So if we need a booster, we'll have time to do that. On the mRNA platform, that vaccine can be made a lot faster than the way traditional vaccines are made. Okay, sorry. So other questions?
Yeah, Dr. CALADO, this is Joyce Kohler.
Yes.
My husband and I were both fully vaccinated. I've had a daughter that has had one 2 weeks ago. One, she hasn't had her second one yet, and wants to visit with two kids that are under 10 and stay overnight because they live in a distance. Is that a risk to me, her, or anybody? Not sure.
Well, I mean, theoretically, you would be under the threshold of really a limited household, right? It's not multiple households together. I mean, if she's not at great risk for anything, then you likely can all visit without the need of mask or social distancing. Because you've been vaccinated, she's already had one vaccination, and as long as her health isn't at risk, then you guys technically can spend the time together. And she could have even looked at that she didn't even have her vaccine, and you could still spend time with her.
Right. Also, I have another question. Is it true that 200 and some people have gotten the virus even though they've been vaccinated, and 2 people have died, which came out yesterday?
Remember, when you have the vaccine, you're not 100%, right?
Right.
We talked about that. 95%, you still have a 5% chance. As far as I know, I haven't seen the data that says that anyone died from having who got COVID, having the vaccine. And when you look again with all the studies that were done, in every case, every one of those vaccine trials, nobody died or is significantly hospitalized who had the vaccine. It was all in the people who were in the group who didn't receive the vaccine. So I'd have to review that, and I'd find that strange if that ended up happening. But
Yeah.
remember, when you're talking about millions and millions, the numbers are going to go, and they are in the millions and millions and millions. That eventually, there's going to be some breakthrough that's going to end up happening.
Right, right. Okay, thank you very much. This was very enlightening, and as usual, you keep us updated. Thanks for your time.
No, thank you. Other questions?
Yeah. Dr. CALADO, this is Chris. Z,
Yes.
I have a couple questions. First of all, regarding domestic travel, I mean, I've traveled twice on Delta during the pandemic, and both times they were absolutely wonderful. You had to be masked and that, but it seems like there's starting to be issues that people are trying to fly without being masked. Do you believe that the airlines will insist on that going forward? Because I think that's a big deal.
Oh yeah, I mean, obviously that comes in a multi-household people together, right? This is so. I mean, they should be if they're going to follow along with the CDC guidelines. They're in a public place. There's people from different families that are there. They should be.
Okay, that's what I thought too. My second question's not so easy, but you know me, I always are thinking. I guess it's a little bit of a moral question in the sense of, what's your opinion on giving the vaccine or us being more actively helping other countries, especially poorer countries, get the vaccine to promote this, you know, global immunity? Because we're only as safe as the rest of the world is, especially if we are going to travel again.
That's absolute. I mean, I can't think that we would live on an island and not think that somewhere or another. I mean, and this is the whole problem about our lockdown that we did originally last year wasn't a true lockdown. I mean, it wasn't in a true sense like other countries, especially in the Asian countries where they had things really locked down, that they were able to get their counts to be low and to be really almost non-existent because they were a lot more strict. But you know, we as Americans won't stand for that, you know, so we're going to fight that. But unfortunately, that now makes things where still the exposure is there. And so think about it this way: if we closed our borders in the United States and we closed it for two weeks, and then we got all the COVID cases to go away, well, it's not going to stay that way because we're going to have people visiting from other countries that are going to come in that are going to have either the variant or they're going to have the regular wild type, and they're going to start infecting people. So it has to be on a global scale that we got to get everybody as much as is immunized as possible because we're just going to keep passing it back and forth. I think you guys have seen this. So people who have family members in their household, you know, and one has a respiratory infection and the other one's starting to brew an infection, we're more likely to go and treat both of them at the same time so that they're not kind of bouncing the infection back and forth. One gets better, then the other person gets worse. That person now passes it along to the other person. The person gets worse again. So, you know, it makes sense that we got to try to help everybody. I mean, the United States has always been that way to help everybody. What makes it different than it is now?
Because countries in Europe, well-developed countries that do not have the production in their country, they can't get the vaccines. I'm talking about France, Germany, etc. It's quite amazing to me that when I learned that firsthand from talking to people in Europe. But it's also, of course, true in poorer countries around the world. So the US is reluctant to give it up because we're still not all vaccinated. But, this is a real catch-22, I think.
Well, I mean, I think the vaccination is going to be a moot point. And the reason why I'm saying this is that when you have AstraZeneca, whatever they're going to do with their studies, is probably going to change to the point that when you look at, if truly it turns out that the blood clots only happen purely in women, then they can selectively say, let's go ahead and open up the vaccine so now only men get it. And then with Novavax that's going to be coming out, which is a very promising vaccine, that will put a fifth vaccine onto the market that would be safe and effective, and that would be available, and they're less expensive. And so the ability to get those vaccines would be a lot easier for other countries to obtain. And maybe also for the time that if everything works out better for the United States and financially, because obviously we have to take care of our own. But if it gets to the point that that help can happen, then it would be done with a vaccine that's a lot less expensive. You're talking, like, I think AstraZeneca is like $2 a vaccine versus when you're looking at Moderna and Pfizer, it's more like, I think it's like $10 to $30 a vaccine. And then the Johnson Johnson, I can't remember how much that is, but it's not as expensive as I believe the Moderna and Pfizer. And then in this Novavax, I think is going to be even less expensive too. So I think, those things, once those come out, I think it's going to make things a lot easier to do things globally to get this down. But, the important thing here is that, yes, it's nice to get everybody else vaccinated. And I think all of you have heard me say this before. In order to be able to help and care for other people, you have to be able to care for yourself to get to be at that point to be able to help other people. And if we get immunized and we have very close and high numbers, like 80%, 90%, that we have people vaccinated, we're not going to be transmitting. And not only that, we're not going to be so worried about people coming over here and infecting us because we're less likely to pick up the disease because we're vaccinated. So that would relax the way we feel and might also give us the ability to help the people, outside of our borders. Because in a way, we would be helping them because whoever is traveling from here to their countries and they've been vaccinated, there's less of a concern about them getting infected by our citizens into their countries. So indirectly, there would be some help in that respect. But I hear what you're saying. I mean, ideally it would be nice if we could do that, but at the same time, we have an obligation to the American people who have suffered, for the past year through all this stuff.
Thank you.
Other questions?
No.
Dr. CALADO, I have a question. This is Mary Ann. How are you?
Okay, how are you?
Good. I got two questions. One is, I have a friend who you do not take care of, and she's in her 70s. She had COVID. She's fine now, but she has lost her taste and smell for months. And I know it's hard for you to speak of this, but generally speaking, do you feel that a person that's going through that will eventually get it back? So I can't even imagine what that would be like to not have taste and smell.
Well, so we don't know yet. I mean, that's these long haulers that are there that we don't know how to fully help them. I mean, could she be one of those people that actually, if she gets the vaccine, that she might feel better and some of her symptoms will go away? We don't know. I mean, there's just reports of people saying that they feel better. Now, whether it would affect taste and smell, don't know. I mean, most of it's more about that they feel that their brain seems to be functioning better and that they feel less fatigued. But I think it's just going to be time will tell about that aspect of it. And just as a side note, I mean, to give you also an idea how bad this virus is, think about this. I mean, when you talk about flu and it's just really affecting just your lungs and just or if you get intestinal flu, it's affecting your GI tract. This is a virus that invaded your brain. It invaded the nerves of your brain to knock out your taste and smell. That is scary. You're talking
Yes.
about a virus that's affecting, your respiratory tract and into your brain and your nerves. I mean, this is not a joke. And this is why I wanted to have this talk, because there's some people out there and say, well, I'm just going to go get the infection and I'm just going to take my chances with it. Are you serious? I mean, you know, there's a storm and then there's lightning that's going on. Do any of us really want to take a chance and run across a field thinking that we could potentially get electrocuted? I mean, no, we're going to try to avoid that as much as possible. So I think that people should try to avoid getting this infection as much as possible. Yeah, the percentage of people that really have bad complications of it or die from it, okay, yeah, you could say it's a small percentage in terms of the whole population, but you don't want to be even one. You don't want even one death to be associated with it. So why even play around with it? Just avoid it. And one of the ways we can avoid it completely and not have to have all this stuff that's going on, quarantine, isolation, mask, sanitizing, social distancing, is get immunized. It's simple, it's quick, and people don't have bad reactions as much on it, and it's safe. I mean, so whatever some people are saying that it's going to make them sterile, it's got a chip in it, it's going to do something to my DNA. It has nothing to do with your DNA. It has nothing to do to sterilize you. It has nothing to do to track you. And you've heard me say it before. Even if it were to track me, I don't have anything to worry about for things to be tracked. If the government wants to track me, let them track me. So I mean, it's not doing anything. I don't think it's doing anything to control anyone. Maybe I'm just naive about it, but I'm just going to side with science about what's going on. I'm going to side with people of different countries, of different ethnicities, of different education levels, of different experiences, that they all are coming to the same conclusion. And that means that this vaccination is safe, it is effective, and it's our way of eradicating this crazy disease that's destroyed our lives for the past year.
Thanks, Dr. CALADO. I got one more question. It's been a while since this COVID thing started, and a lot of people are getting their injections and everything. Now, are you, now you know I try to stay away from your office as much as possible. No offense. But are you seeing patients like you used to, or are you still not seeing patients in your office?
We're seeing patients on a selective basis. I think we have like one day that we see people here in the office. I mean, there's some things that you just have to be seen. I mean, health is good, but sometimes it's better to be able to examine you physically, be there face to face to discuss what's going on instead of trying to do it by telehealth. So yes, we are. When we had that scare, we backed down on seeing people just to make sure that we weren't going to convert over and become positive and we were infected and we're all clear. So and the problem is that you have no idea who ends up coming in the office, and with me having to take care of all of you, and many of you are all at high risk, we just don't want to get any of you infected. So if it's something that we take care of by telehealth, then that would probably be preferable for right now, especially with the variants that are out there. But I think that, again, as more and more people get vaccinated, that concern is going to be very, very low.
Okay, and that's it. I want to say one thing. Thank you very much for being my doctor, and I really appreciate you for everything you do, Dr. CALADO. You love your patients, and it shows, and you have a blessed day.
You as well.
Yeah, this is Larry Slimick again. I think this was Mary Ann that brought about how long some of the symptoms will last. I'll give you 2 reference points from our family. For the granddaughters, it took 2 or 3 months before they got past the sense of taste and smell and got them both back. But I have another niece that as of 2 months ago, and she got COVID literally a year ago now. She still had not had her sense of smell and taste back. So I'm gonna go recommend to her, based on this discussion, that she would, it wouldn't hurt for her to go get the vaccine.
Yeah, it would, so that they can get it and they can be protected.
Yeah.
Again, it's not a big rush for that. I mean, to take the vaccine 3 months after being infected should be fine.
Yeah, though this one was the one a year ago in April. That she still, last I talked to her a couple months ago, she still didn't have their sense of taste and smell back.
Yeah.
So she might be helped by the vaccine based on what you were saying earlier.
We don't know. I mean, that's just the reports by some long haulers who have received the vaccination and they felt better. So
Yeah.
I mean, regardless of whether it's going to help her or not, it's important for her to get vaccinated. If she does get the benefit from it and she does get improvement, then wonderful.
Yeah.
It's great.
Okay, thank you.
Thank you.
Dr. CALADO,
Yeah.
this is Cindy Olson. I just wanted to say thank you, and I'm so very sorry for the loss of your coworker and friend. It's just so sad.
She was actually one of her patients.
Oh, I see.
Yeah.
Still. And
And
thank you again for, I mean, yeah, it's never easy, so. But
Yeah.
thank you. Thank you for doing.
Thank you. I appreciate that. Other questions, concerns? All right. Well, thank you all so much for being on the call. Please pass along this information so that people who are concerned about some of the misinformation that they're getting, that they might feel comfortable. Again, this will be downloaded to YouTube. Probably won't be there for, I don't know, 3 to 5 days or something like that. But it should be there if you need to review. Okay. All right. Have a great day. Sun's kind of out, and the temperature is nice, and just it's time to enjoy. We can't keep staying locked down. So,
Thank you.
Thank you, Dr. CALADO.
Oh,
Thank you.
Thank you. Take care. Bye bye.